25 years of Viagra. Where are we in the state of ED? Stay tuned. It's been 25 years since Viagra came out in 1998. It was actually created to treat pulmonary hypertension or high blood pressure in the lungs. And then they inadvertently find out, oh, one of the side effects of this medicine, Viagra, gives particularly these men an erection. And therefore, these men were loving the medication. So it's actually a side effect rather than it was mainly created for sexual dysfunction such as ED. And I want to quote this article by Art Kaplan. He is in the Division of Medical Ethics at NYU Grossman School of Medicine. And he wrote a commentary, and I want to dive into it because it's really essential to what my message has always been is that what's been happening then and what's happening now with Viagra. Have we made any strides since 25 years of Viagra? Believe it or not, Senator Bob Dole, who then also ran for president, actually was the spokesperson for Pfizer, the company that made Viagra. He came out and did a commercial for them. And he was a distinguished, respected national figure. Second, he was a conservative. He did a commercial and say, "Hey, I have a medical problem. It's tough to talk about it, but there is a treatment that I'm bringing it out of the closet and say, hey, I have sexual dysfunction." I did not know that. I thought it was great that Bob Dole did this, and he was married, he was a conservative, and he was used to deflect conservative or religious critics that were worried about the promotion of sex outside the marriage. But at that time, Bob Dole was married to Elizabeth Dole, and he was considered a family man. He was the first spokesperson, and Viagra lost its patent in 2019, and by that time, it already made 40 billion with a B, not an M, $40 billion at that time, and that was actually 21 years at that time. What the company wanted to do was that it wanted to market it for a disease, and it recruited Art Kaplan to be on the team. They didn't want to get involved in criticism about this miracle drug for an old problem, and impotent wouldn't do, but they wanted to address it as a medical disease. So the word erectile dysfunction was the answer after they met with urologists and sex experts, and they didn't realize that this was such a common problem, that it was that popular. But when a Viagra came out, it was an impetus for people to say, hey, I have ED, I'm guilty. I feel stigmatized. I feel ashamed. I feel guilty. Now I'm going to use something that might help, and I'm going to ask it from my doctor. However, over the years, it's been very, very easy to get Viagra online and on demand. I myself, as well as our Kaplan, had gone online on ED dispensary and can get an ED medication within a few minutes. Briefly talking to a doctor online who prescribed ED medication fairly quickly. But however, we all know that ED is a symptoms of a larger disease that is causing blood flow restrictions, such as high blood pressure or obesity or diabetes or high cholesterol or even smoking as well. And that should be the reason that should be looked at to reverse ED instead of just taking a medication for the symptom, almost like taking opioids pain medication for back pain instead of trying to find other treatment for back pain as well. So we come a long way in taking the issue of ED to make it more less shameful and it's still embarrassing and it's still not out of the closet completely, but better than it was. What our captain said that I really like is that if you do not have a medical condition that restrict blood flow, it's still going to go down to your penis regardless. So you don't need a medication to bring blood flow to your penis, but you should really take a step backward and look at what condition is causing the decreased blood flow. So treat the disease instead of the symptom. The symptoms is erectile dysfunction. The disease is perhaps poor blood flow or maybe performance anxiety or depression. As I said before in my podcast, 90% of ED is physical and 10% is due to psychological reason. However, we have not taken big stride in creating a medicine like Viagra for women. Right? It's been 25 years. Women do not have something that is similar to Viagra. And we're not come a long way in trying to treat the underlying causes that is causing ED at this time. We may strive in bringing ED to more mainstream, but would not make stride in treating the cause of ED. So that is something to think about. So even today, it is still hard for many people to speak up and say if they're having problem in bed, and we want to make sure that we can bring this issue up and try to make it a common thing to discuss about, almost like having pain, almost like having shortness of breath. There's nothing wrong with having problems in bed, okay? And it can be treated without medication, but we need to look at the disease that is causing the problem. So, overall, the approval of Viagra was a good thing. It brought a terrible problem into the open for discussion and enhanced many men quality of life, but it's still difficult to talk about the problem in the bedroom, and we've not made strides for women yet at this time, and that we need to looking at the underlying cause of the disease, and ed is a symptom of the disease. We still have more grounds to cover. I hope that you join me in this mission through this podcast to create the sexual revolution. Sexual revolution is to bring problem in the bedroom out to the mainstream and try to create a sexual independence. We know that you can still have sexual longevity, still enjoy sex to the day you die. We've seen it in men who can father children in their 90s and in their 80s without artificial insemination. And I've seen in my patient, an 80-year-olds that are still able to get an erection without medication. So it can be done. It takes some work, yes. As you get older, you have medical diseases such as high blood pressure, high cholesterol, diabetes, and weight gain. But if we know now, when you're in your 30s, you can change those risk factors to put you at risk for that, for hypertension and for high cholesterol, which then will extend your sexual longevity and eventually quality of life and probably heart health as well too. So let's create a sexual revolution together for sexual independence and sexual longevity. Join me in this mission and we can do it together. Thank you. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board-certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? Now, here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get 2 of these strips, which you will use along with simple instructions to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problem with circulation and heart health, this can also be a great way to prevent heart-related problems such as strokes and heart attacks. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.